The health ministry yesterday said that a third wave of COVID-19 is now imminent and that India should be prepared for it, although we don't know when exactly that third wave will strike. Now, we know that the second wave took everybody unawares, if not the fact that there would be a second wave, at least the intensity of it, which is why you can see India struggling to sort of battle this wave. So Abantika Ghosh, who, as you know, leads our COVID coverage, is going to try and help us understand why the health ministry has said that a third wave is imminent. What does it mean in the context of vaccinations and the fact that it's important to get the entire population vaccinated, and how India can prepare for a third wave so that we don't find ourselves in the kind of crisis that we do today. Do start sending in your questions for Abantika on this episode of Government Matters. Abantika, so when will you stop bringing bad news?
Oh, the question I've been asking myself for the last 15 months. I'm sick of writing bad news, actually.
I know, no. So, yesterday the health ministry did say that a third wave is imminent. What did they mean? I mean, did they mean that there would keep being these phases and waves because the virus will mutate and that's likely to keep happening?
So, to understand why there'll be a third wave, we need to understand why the first wave sort of fell, why first wave ended, and why did the second wave happen? Because let's face it, no matter what the government of India tells us, and this the government of India itself admits, that there was nothing that the government of India per se did which made the numbers come down last time. Last time, somewhere around September, what happened is there are several things. One of which is what percentage of your population is infected. And then what percentage of your population is very strictly adhering to COVID appropriate behavior. Now, in September, we were in unlock, right? But what had happened was people had become very, very cautious. All of us, we had become very cautious. We had made COVID appropriate behavior our second nature, and coupled with a person who has had immunity, the latest, who has had the disease, the latest data seems to suggest that they are immune for about 80% of these people are immune for up to 8 months. So given that immediate amount of immunity that was available in the population and the fact that people were being very careful, gradually these factors together brought the numbers down. Then when we started opening up and people started dropping their guard, the virus also mutated. Remember, the government of India's position still is that the mutation has a very small contribution to the current surge. So as the virus mutated, but experts differ, so we will go by that thing as well. So as the virus mutated, people were dropping their guard, and then a lot of people had completed their 8 months, remember? So that population level sort of immunity also started coming down, and then this surge happened. And I think why this surge went up so high is because for a very long time, initial warnings were ignored, and as we all know, we've discussed this many times, potential super spreader events were allowed to happen. Now, that being the reason why the second wave happened, the third wave, let's now look at it from the third wave perspective. The virus is definitely going to mutate. So what happens is, anybody who's read a bit of or remembers a bit of evolution would understand survival of the fittest. So as you're putting more and more pressure to get rid of the virus is under evolutionary pressure to mutate. So the more of these vaccines and drugs and plasma and all of that you throw at it, it is going to mutate. So that's one thing. Then again, these current levels of lockdown, current levels of fear, current levels of safe behavior will not last. At the population level, they cannot last. Also, you will have to open up. That's a fact. And look at your numbers currently. You have that's like the cumulative number, but you already had over 2 crore cases. So these numbers will take time. Every day, if over 4 lakh people, between let's say 3.5 and 4 lakh people are being infected, that still leaves a huge percentage of your population vulnerable. So all of those things taken together, I think that's the reason why the principal scientific advisor said that third wave is imminent.
Okay, so now that we know that a third wave is imminent, and in this, our lesson from this wave is that you can never predict the ferocity of the wave. So how can India be prepared for a third wave, which may or may not be worse than the second wave? And what is the government really doing to prepare? I mean, one is the question of how, and the other is what is being done.
Let us face it, a lot of the moves that we are making now, for example, all these PSA oxygen plants, the import of oxygen, all of these things that we are doing, the change in regulations, unfortunately, they might be too late for the second wave. Essentially, these are things that will ease the third wave, the way I see it. Similarly, I think the most potent weapon in our arsenal currently has to be the vaccines. And if we know for a fact that there is going to be a third wave, we need to put heaven and earth together, literally, to step up vaccinations. Our vaccinations are on a constant downslide. You know, at one point of time in April, I think 2 days in April, we'll hit about 40 lakhs. Then we were doing between 30 and 40 lakhs several days in April. But now look at those numbers. They have fallen so much, 12, 13. Average, I think, has come down to 18 lakhs now. That kind of vaccination is not going to get you there, because ultimately all of this oxygen, drugs, remdesivir, plasma, whatever else, or hospital beds, look at the numbers. At 4 lakh cases, now is 4 lakh. We are not even talking about the size of the third wave, but at 4 lakh cases, even if 1% people need ICU, how much are those numbers? It's a huge, huge number. So no matter how much you ramp up hospital infrastructure, you can put up beds, but where will you get doctors from overnight?
Right.
You can arrange for oxygen, but where will you get the doctors to administer that? So those kinds of things, I think our real best bet for the third wave is vaccinations. There has been the IP waiver US has just announced this morning. So maybe that will help ease the supply of vaccines, because currently the domestic manufacturers, or even if you count Sputnik anyway is going to come in very small numbers. So domestic manufacturers, as per the affidavit that the government of India has submitted in the Supreme Court, domestic manufacturers and Sputnik together, we are looking at Sputnik obviously is going to be manufactured domestically as well. We are looking at just about 12 crore vaccines per month by July. And just the 18 to 44 years age group, you need 100 crore doses. With wastage, that would be 120 crore doses. And you still have leftovers from the healthcare workers, frontline workers at 65 plus population that are still to be vaccinated. So we're really looking at huge numbers, and we don't really have the luxury to take 8 months or 10 months to vaccinate our entire population, because remember, we don't even know if 8 months, 10 months later, you and I got our vaccine shots this month. We don't know if next January we have to take a third shot or not.
Right.
There are many ifs and buts in an emerging pandemic situation. We just don't have the luxury to go at the pace at which we are currently going.
Right. Abantika, as you rightly mentioned, infrastructure is going to be limited. Vaccination is the answer to be able to deal with any subsequent waves of COVID. And you've also mentioned how our vaccination game has been really, really below par. But besides the fact that there perhaps is a supply issue, there is a supply side problem, what are the other bottlenecks? Because we do see that it's, this program should have been far smoother in a country like India, where you would have anticipated the fact that these are these many people who would need vaccines.
I think there's been a lack of planning, and also somewhat inexplicably, and I don't understand this business of the center versus the state government in one way or the other in vaccinations. It's really baffling, if you ask me, because so every day, and this is something that I personally feel very strongly about, every day, so 4,000 people are dying every day, and every day the government of India brings out a statement saying we have so far given 16 crore vaccine doses to states free of cost. That is, it looks so ugly. It reads so ugly. And even now, when you're asking them that what are vaccinations, they are constantly saying, no, states can do 18 to 44. We will continue with our 45 plus. Great, do that. But at least ensure that states and private hospitals are not ending up fighting each other for like this many doses. That's what the situation is. Private hospitals are literally hand to mouth now in terms of vaccine supplies. If you go on to COVID, you will see slots are available maybe for today, tomorrow. That's it. Beyond that, there are no slots because there are no vaccines. As and when vaccines are coming in, slots are opening up. State governments may be a little better off, but I don't know. I mean, so far we started with 12 states which were doing 80 to 44 years. Now it's down to 9 states. So
Right.
This business of, and see, in every other vaccine, it has been the center which procures bulk procurement and gives to states. That has not happened here. And then again, the center negotiated different prices for itself and different prices for state government. It is this entire sort of commercial focus of COVID vaccines. Commerce is important, of course. It is a very investment-intensive industry. Commerce is important. I'm not saying don't make profits, but this differential pricing, this differential thing of center is doing this, states are not doing this. I think we are in a state where we can't afford this, really.
Right. I mean, it seems like a very unseemly, unpleasant contest.
Very.
Right. Okay, this question is from Parth Gupta. Do you think that we are heading towards a national lockdown? Some of the news reports are claiming that the talks of it are doing the rounds in the PMO.
So even yesterday, Dr. V.K. Paul said that all options are still on the table. Those are being discussed. But from what I understand, the Government of India, the Ministry of Health, they are not keen on a national lockdown again yet, because remember, the numbers are rising at different rates in different places. So
Right.
this time, for example, when Delhi did a lockdown, that was a classical lockdown scenario because you did not have beds. You had to bring down the numbers somehow. And we have brought down numbers a little bit, just a little bit. The daily numbers are a little down, positivity rates, though they are still very high, but they're down from the high. So, and that point of time, you had to bring down numbers so that hospitals can do their
cope with
the surge. But to do that nationally at this point of time, we might make the same, to my mind, mistake that we did last year, that you lock down too early and you actually bear the full force of the wave after the lockdown. So your ace, sort of, you've exhausted your ace, and then you're left to fend for yourself. So, and then again, circumstances have to lead to it. A national lockdown, for example, if you lock down, say, Manipur right now, does it make sense really? So that is my question, and I think that is partly why the Government of India is not too keen on that option right now. Though, I mean, worst comes to worst, that's something they will have to exercise.
Right. In fact, what my sources in the PMO also say is that, I just because of you pointed out that there are talks in the PMO that a national lockdown is not what the PMO is also in favor of. It's targeted lockdowns, it's focused lockdowns, because really, as Abantika mentioned, a national lockdown in a scenario like this doesn't quite make sense. All right, this is a question from Kavali Meghna. What does a wave mean? Is it the number of cases or mutants?
No, wave simply means a surge in cases. Mutants can be the reason for that. Many other reasons can happen. But a wave basically means, the numbers surging like a wave in a sea.
Right. Okay. Rais Ahmed, can we not share the formula with other Indian pharmaceutical companies to increase the production? I think he means of vaccines.
Yeah, so that is another thing. Covaxin, for example, was developed with ICMR's help. ICMR, in fact, is getting royalty from Bharat Biotech for Covaxin. So again, it's a very important question. Why we have now moved, we are trying to get Hafkin Institute to manufacture it, Indian Immunologicals and one other company to manufacture it. But it again beats me why it took us 3 months to take that decision, because Hafkin's proposal came in February. For 2 months, we sat on it. And now Hafkin, the problem with that is Hafkin needs a year to prepare. The government has approved it now and they are saying, please do it in 6 months. I don't know if they can do it. But we have also moved very slowly on getting other manufacturers to manufacture these vaccines. We have just banked on one manufacturer. okay, the serum product is from AstraZeneca, so it's for AstraZeneca to decide whether they want to bring in more manufacturers. We could have pushed for that as well, but that's a different question. But co-vaccine, certainly it was within our purview to have done it, but we did not do it. And this, I think somewhere in the government, the belief was there that we would not need to vaccinate the entire population. Whether that was wishful thinking or whether that was belief based on scientific evidence, I don't know. But I'm absolutely certain, because I've had these conversations, there was a belief that we will not need to vaccinate, so we will not move to get the supplies increased.
Right. Okay. This is from Mitradu Chaudhary. US said that they will support the patent waiver in WTO. Does that mean that we can't manufacture as of now? If yes, then how will we have the vaccines arrive on time?
Yeah. So I was having a conversation with somebody this morning on this, and he told me something very interesting. He said the government saying we will waive patents is great, but the company has to actually come out and say that we are waiving these rights. Once the companies do that, only then can we move. So it's not like it's a done deal that US has announced and from tomorrow your companies here will start manufacturing Moderna and Pfizer vaccines. So that being the case, it's a bit of a, I mean, it'll take time. I'm sure it'll happen, but it'll take time. But then again, if we are looking to control the prices of these vaccines, that may be an additional pain point. If we are looking at a 300, 400 rupees pricing for a Pfizer or a Moderna vaccine, that may be a serious problem.
Okay. Abhinav Keshav has two questions, and I'll end with these questions. One is, will India witness normality after the end of the second wave? Now, that's a question that I think Abhishek Keshav, everybody wants to ask Abantika, when will we become normal again? And the next question is, when will the third wave hit us? Will it be in October?
Government doesn't know that. The second question is easy to answer. Government doesn't know. I don't know. I think we can have some semblance of normality when, say, 80-90% of your population gets fully vaccinated. And I don't see that happening too soon. And then again, you will have to deal with the possibility of vaccine escape, of at least some variants being vaccine escape. So they're still happening. Maybe the ferocity of the disease will be less, but it's still possible that the disease will happen. So normal life, as in before March 2020, I would say is a long time away, really. But maybe normal life like we were before
the second wave hit.
April 2021, maybe that kind of normal life, if we are very careful, that can probably happen in the next 3 months or so. But we'll have to keep being very, very careful. We can't let our guards down.
Right. Okay, I'll take, one last question. I know I said I'd end there, but this is a valid question from Sumit Pal. How do we ensure vaccine reaches a critical mass like the polio vaccine? Because, we know how the polio vaccination drive has been among the most successful vaccination drives in India.
So polio, actually, the kinds of things that polio did, we have already started doing, honestly. Because we are roping in temples and mosques and all that to talk about the importance of vaccines. We've already done that. But currently, I think more than these sorts of outreach to the population to tackle vaccine hesitancy, what we really need to do is to have enough for a vaccine eager population first. Those are things that will come in. You'll have to rope in community leaders, religious leaders and all that. But we'll have to first address people who are willing to get the vaccine and then move on to the vaccine hesitant populations, really.
Right. All right, Abantika, thank you so much for once again explaining what the scenario right now is with respect to COVID-19, explaining the health ministry's comment on a third phase being imminent. Now, I really do hope the next time you come on Government Matters, you bring some good news for us and some good cheer. Thank you so much for watching Government Matters, for sending in your questions. Please keep subscribing to our YouTube channel.